we assume, we have that assumption that, oh, they masturbate often. They know what they're doing. They start young, they start early, they have exposure to porn.
You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your private, helping you get in the know, down the low.
Hey friends, Dr. Susie G here, and welcome to another In Your Pants podcast. Thank you so much for being here. We have a fierce episode for you today where the occupational therapist and the physical therapist unite in their passion and mission to embrace and help others embrace sexuality across the world. I have Dr. Sakshi Tickoo with me, pronouns she and her, and we discuss topics of incorporating sexuality, sexual health and wellness into the rehabilitation realm. We talk about pleasure mapping, body mapping. We also discuss some cases, real cases and applications of combining physical therapy and occupational therapy to enhance someone's sexual wellness and sexual health. So without further ado, let me formally introduce to you Dr. T. Dr. Sakshi Tickoo is the founder of Sex, Love, and OT. She is a queer occupational therapist and counselor actively working in the areas of sexuality, intimacy, relationships, and mental health across the lifespan. She has worked in school-based, home health, outpatient settings, and currently caters to clients globally through telehealth care. She believes in advocating and education for everyone with or without disabilities, whether straight or queer, to experience filling, satisfactory, consensual, pleasure-centric, and exciting relationship irrespective of their physical and or mental health conditions, sexual orientation, and gender identity. So I had so much fun with Dr. T on the show. I am so excited to share this episode with you all. I hope you really enjoy it. And if you do enjoy it, please be sure to subscribe, to comment, to rate us, to like us, and to share with all of your family and friends. This is one certainly you don't want to miss. Enjoy. Hi, Dr. T. Thank you so much for being on the show today.
My pleasure. You know it. I love it.
Well, I'm super excited to have this beautiful collaboration. It's the first time ever on the In Your Pants podcast that I am interviewing an occupational therapist who also specializes in and has a passion for sexual health, wellness, and education. So let's start there. Can you describe to us what the role is of an occupational therapist in rehab and sexual health and wellness?
It's a wow. This is a fun thing. I love it when we have to describe our role as in this field, especially. I have this very fun way of describing our role, going away from ADLs. So usually that's how I think people are familiar with occupational therapists. We focus on ADLs, which is activities of daily living. And we try to focus on the daily living occupations and how people can engage in these activities in a much better way. And sex being one of them. However, interestingly, I stopped using the word sex and sexual health and I started using sexuality instead, because when we say that occupational therapy not only is there to improve, but we are also there to prevent in the first place. So if sex is an occupation that we're engaging in, sexuality is our overall experience. And that is where occupational therapy steps in to make sure that you have a more enriching experience. You try to adapt in that experience in a much better way. Be it understanding the gender, be it expressing your gender in various ways, what kind of clothes you want to wear, how do you want to adapt to trans masculine or trans feminine equipments that you want to wear, what are the options out there, how can you adapt to sex toys, how can you make this activity much more comfortable for you, and there's just so much more. And that is what basically all occupational therapists do. That's just in sex. The same things, just to help you have better sex.
Right, right. Pooping, peeing, and sex are all every like physiological functions and are very important as part of the health paradigm. And as you're saying, sexuality, identification, connecting with oneself and partners. I can't imagine that traditionally, at least not in the United States, that sexual health and wellness or sexuality is part of the curriculum for rehab practitioners.
It isn't. I think we had this conversations where I told you it was only in, I think, 2015 or 14 that I even actually saw the entire image of clitoris. And I was already enrolled in a bachelor's in occupational therapy. And I do not know what a clitoris looks like. So, yeah,
Uh,
that just explains what
mhm.
we have been taught.
Right, right. And I'm in the same boat, Dr. T. Like no one talks about, I mean, medical or not, like there's such a lack of sexual health education and even just anatomy and understanding our body and how it functions. Such a stigma and taboo. So what you're doing is so unique and so needed and such a service to the world that I am in awe and you're such an inspiration. So I just want to say that because you are breaking the mold when it comes to occupational therapy or any type of rehab practice, to be honest with you, because not a lot of physical therapists. It's pelvic health, but yet sexual health is or sexuality is kind of somewhere over here. Like, yeah, we know it's part of it, but we're just not going to talk about it. you know?
Absolutely. There are actually handful of physical therapists that I think actually pursue pelvic health. So yeah, I think we are the ones who are breaking the mold. It's not just I, it's we.
And if we were in person, I'd totally high five you right now.
High
Sometimes
five.
virtual high five. Well, I want to talk about some juicy stuff. I want to talk about pleasure mapping because that's something I do in my practice. Yeah, fingers. For those who are listening, yes, we're doing some jazz hands here and fingers. Um, how how do you incorporate pleasure mapping into rehab with your patients? So maybe and I have a couple of questions with that. Let's start with maybe what is pleasure mapping? Let's just start there. What is pleasure mapping?
So it's pretty straightforward actually. Just split the two words. You are trying to map what feels most pleasurable, right? And by pleasure we mean that so occupational therapists love sensory integration. We talk about sensations all the time, right? We have such groundbreaking research in sensory integration, and yet we forget that there's so much sensation happening when it actually comes to sexual activities.
Mm-hmm.
So pleasure mapping was just whatever I had learned in a pediatric setting being applied to sexuality and everything else. So in pleasure mapping, we use different senses to map how we experience pleasure. It's actually that simple.
I love it. I love it. And you're applying it to all parts of the body. Like as you're saying, how do we experience pleasure and joy and that sensation, right? And like when you with your patients, like because pleasure can be defined in many different ways. So how do you bring up that first of all, how do you bring up this conversation with folks when you're working with them as far as introducing pleasure mapping, but for their sexual organs?
I usually have this one question about whenever I have my history taken, or whenever I have this set of questions when we talk about how their sexual practices are and what everything else is. So I usually ask them this question about what does your pleasure practice look like, and they or most of them have a very confused look as to what the hell is she asking about.
Yeah.
And I think that is how we take the conversation forward because, as you very rightly said, pleasure is quite subjective, right? And I asked them, what's that one part in a day or in a week that brings you most joy? That's just so pure that you cannot skip it, you cannot live without it. And most people have the most obvious answers, which is like having a cup of coffee or just cuddling with my pet, and some brilliant answers like that. It's a common thing, right? And then I'm like, you know what? This is something that you go back to ground yourself, right? So, what is it that you do with yourself or with your body that helps you reconnect better and, have that sensation that wow, I'm a goddess, I'm a god, I'm absolutely amazing. That yes feeling, that just, queen, you're killing it, that vibe. And that is when they start thinking that, I haven't, and it's a very good way of self reflection as well, because we find partners along the way, we find fun along the way, but we forget the connection that we share with ourselves or even with our relationships for that matter. And this is a very good reflection of things that we have missed out, things that they enjoyed doing, or that they have missed out in their lives, something that they left along the way. And this is something that we call in occupational therapy language as activity analysis. We are sort of analyzing the whole thing, and it's not just the present but also the past. And it's the best way of saying that, this is what, this is what we mean by pleasure. This is what the pleasure practice could look like, and this is how you need to be focusing on, maybe, let's start there. If you can pinpoint us some practice, I used to love that bubble bath, or something of that sort. I love journaling, or I just love the way that I apply lotion to my body, or I just love dancing around naked. Even if there are these parts which bring them pure joy, which helps you reconnect and feel you, and help you feel a little bit more human, that for me it becomes a pleasure practice, because you know that this is the body that I love, this is the person that I fell in love with, and this is the moment that I appreciate and embrace a lot. So I think that we begin in a very, very non-sexual way first, just to understand that that's the first step of the journey. Most of the time, everything what comes to all forms of sex becomes a lot more easy once we are comfortable in our own skin, in our own space. That's the beginning of having these uncomfortable conversations.
I just love that. Again, you're taking it from a global, broad perspective, getting the person to feel, like you said, human again, connect with themselves in a way that makes them feel powerful, not powerless, right? So you're bringing back that sense of agency, self-efficacy, independence, because for a lot of folks, there's whether it's pain or a chronic illness or a change in their body in some way or function, there's a lot of grief and loss with that process as well. And so you're like the number one fan, like, let's do this, let's see how we can make it work. It doesn't mean it's the end just because things are different. And just, yeah, I just love that. I love how you're kind of using all their senses and everything in their world to help them connect to their own humanity and identity. And also then funneling it in is what I'm hearing you say, is like into that sexual realm slowly. So we're not just starting with, okay, let's work with the genitals now, right? Because it
In a way, yeah, I think in a way that makes them much more comfortable, knowing that
mm,
you're not here to put a label, and just carry forward with whatever diagnosis they have been given,
right.
but you're here to understand them as an individual, and the concerns that they present. It's not symptom based. Even if they might be having a fabulous sex life, it might not have affected them in any way. There's a fair possibility of that, right? But my job here is to evaluate that even if they are having fabulous sex lives, or they still have the ability to orgasm, they're still feeling human and still feeling amazing about those orgasms.
I love it. I love it. That's right. Feeling human and feeling amazing with those orgasms. Yes. Oh my gosh. So let's talk about some pleasure myths that are out there. What are some of your, like, you cringe when you hear them? Can you share some of those with us?
The biggest one, I think you know this too. Oh, so I owe this to my partner. I have to do this. I
Uh,
need to get better so that my partner feels satisfied,
yeah.
or they do not cheat on me, or it's linked to penetration,
Mm.
or it has to be linked to, it has to do something with the genitals. I think, yeah, these are the common ones which I'm going to be like, come here. This is my hand. Please breathe your cheek. Let's do the work.
That's
No,
right.
kidding. didn't do that in practice.
I wouldn't imagine you did, but I hear you. I mean, you're fierce. You're fierce, and it's in your dismantling these stigmas and taboos and sexual scripts, negative sexual scripts that we often hold. We often kind of have the standard or expectation that we have to follow it, and when it's not happening, then the whole world comes crashing down, right? Because we've been working so hard at trying to meet and match these expectations sexually, that when there's a slight little change in anything, it's very distressing, and legitimately so. I don't want to undermine that in any way. It is certainly distressing, but I think the toxicity is from what culturally, socially, just what we've been fed over time, that really shaped these lenses and this negativity around sexuality.
At some point, I think even I would keep the culture aside because I think it was the entire human race that took the liberty of dismantling and just molding it around in a way that suited them the best.
Mm-hmm.
So even though I think this comes a lot, and I think even you must have heard it. India is a very conservative place. The people are very conservative about their sexual practices. If we were as conservative as you would want us to be, we wouldn't have one of the most highest population in the world. So
Mm-hmm.
we're definitely doing it, right? But when we look back, and I kept saying this a lot, it's the culture, it's the culture, it's the culture. To be very honest, we have such amazing paintings saying that monogamy is bullshit. There
Mm-hmm.
were there, there were people who actually practiced polyamorous relationships. Kingdoms flourished because of that. They were actually talking about how to enhance pleasure. What is the art of sex? It's not just about having acrobatic postures and whatnot, but they were actually talking about pleasure. What can you do with regulating your breathing? How is the way that you can meditate and find that calmness and grounding exercises so that you can have better forms of sex. And that is something that's so interesting because even though we have been said this, that our culture says that you have to do this and you have to do this,
Mm-hmm.
but we also are talking about pleasure. And this is somewhere down in what, 15th century? 15th century people, they're writing things about pleasure. And we are sort of missed that entire thing just as human race because we found it's the society I would want to blame and not the culture because I think they did such a beautiful job.
Absolutely. No, and well said. Well said to reframe that. I so appreciate that perspective because it's so true, right? It's like when did that all of a sudden change and fall off the face of the earth, right? Not entirely, but and what I'm hearing you say is that it's such an important part of our sexuality and our sexual health in general. And on that topic, Dr. T, what else do you feel is important for our sexuality? I guess what are some of the key components that one should reflect on or embrace or work on or fill in the blank as far as you know for our sexuality and our sexual health?
So when we talk about sexuality as a whole, we speak of it having five circles, actually six, in which like the core circle is about your values and beliefs and who you are as a person, right? That's the center. And then there comes other of these circles which talk about sensuality, which is primarily um, what we were speaking of when we speak of pleasure, when we speak of sensation. That's the circle that covers all the sensual part where you just try to connect with yourself. When you try to understand, oh, this is who I am. I'm so amazing. And that snap of, this is who I am. Then comes the circle of intimacy, which again is such a beautiful thing. And again, a very beautiful thing that's been lost and art that's been lost because we are all busy
Mm.
with everything. Now with telehealth, now with virtually and everything else. But this is another very, very important thing that I love to speak about is intimacy because there are so many things that we can do in that area just to help build that desire. Forget about arousal, let's just keep that thing aside. But the need for people to even have sex or any form of sex or to get even naked, to even masturbate, to even touch themselves. The primary inner motivation that's desire that we're talking about, that itself is lost.
Mm.
And I think once we are trying to even approach towards a pressure practice or any other practice for that matter to understand sensations, there needs to be a first step of first inner drive. And intimacy is something that helps in building that desire, that inner drive so much, in understanding that there is things that we need. And for building intimacy, I think the bestest thing that we have done as humans in research is the five love languages. It's
Yes.
beautiful. It's beautiful, right? It's the best way of developing intimacy without having to focus on genitals, without having
Mm-hmm.
to focus on performance, knowing that we have to put in so much effort. No, it's just so easy. This, we can talk, we can cuddle, we can just have a candlelight dinner, we can just sleep.
Right. Right. And just be okay in that space, right? And that just feels like there's so much pressure that just falls off of our shoulders when we embrace that type of mindset around intimacy or sexuality and how it just ebbs and flows. It's not like a dualistic, like it's here's intimacy and then here's sex, right? Like no, it ebbs and flows kind of like a wave that just rises and falls to and crashes on the beach. Like it's part of the same water. And it gets overlooked. So I'm so happy, Dr. T, that you're bringing this to light and sharing the importance of intimacy and connection on an emotional level, not just the physical level. Although it impacts the physical level as well, because emotions, and physicality are processed one and the same, right? So um that brings me to talking about some of the negative emotions that might arise when someone is engaging in pleasure activities, particularly when it comes pleasuring around sexuality, maybe I should say that, or exploring their sexuality in the way that you're describing or that we're talking about. For a lot of my patients, I have the themes are shame, guilt, embarrassment. Um, if it's a Christocentric, religion, sometimes it's, a sin, right? So how how can we navigate, or how do you work with your patients to help them navigate these feelings that are very common? I think they're also very natural to have because of everything we're talking about. So how do we normalize these feelings, but also don't kind of get stuck in those feelings?
So I think we there was another another thing that I was going to add another adjective to it. It was boredom. That is
Yeah.
something that I've recently realized. Something that
100%. Thank you. Yes.
we recently realized that I did at least. It was happening out of boredom. Um, so with shame and guilt and boredom as well, I think the primary reason when it happens is that, so when I was speaking to more people with or bodies with penises, the the fact is that it's we assume, we have that assumption that, oh, they masturbate often, they know what they're doing, they start young, they start early, they have exposure to porn, anything can arouse them, they won't experience this kind of concerns with, I primarily do not have any problem with lubrication. They don't have to worry about these things, they just have to get a wank and just move on. And
Right.
these these are the assumptions that everybody makes.
Mm-hmm.
Even people who even bodies with penises have these assumptions about other bodies with penises.
Mm-hmm.
This is not something that goes out, right? And so this this script around, this is normal and this happens with everybody, is something that's being passed on. Nobody is having those genuine conversations. When instead, if you see people with vulvas who come together, they communicate, oh, this is what you experience, I experience the same. And suddenly there's a validation in that fact. you masturbate, I masturbate too, but there's the validation again, right? Sometimes it's just assumed that people with penises will know everything about themselves, and
Mm.
for them to experience shame and guilt is not something that's happening. I do understand how the scripts have come for bodies with vulva, because we didn't even know what clitoris looked like until like what, 10 years ago. That's
Mhm.
it. but, but everything but every other research that's been available out there is for bodies with penises. However, the research on how do you actually pleasure, and I'm not saying masturbation or touching yourself, but actually experience pleasure for bodies with penises, is still a research that's not being done well,
Mm.
or at least not being communicated well. And when that's not done, and when that kind of empowerment is just lost in the entire translation of there has to be a pleasure activism, we need to be having equal orgasms, and everything else. I think this empowerment should also come in the form of this is what people with penises can do. There are other techniques for them to do these things, and it shouldn't be limited to the fact that there needs to be some kind of enlargement, there
Right.
needs to be some kind of lengthening, they do need some special toy to experience something. Sometimes the joy can be as simple as probably wearing some disposable soft silicone rubber gloves,
Uh,
which still give a very good sensation. With adding a good amount of lubricant, you can still have a very good sensation. You can just dip your hand in cold water and then again try to do that. It's
yeah.
a very good temperature play, right? um, I think the way that we connected in the first place with the reel that I made, you can go ahead, touch your balls, massage them. You can do so many
Yes.
fun things with balls, right?
Yes. Touch your
I think
balls. They're there for a reason. I love it.
even the intersection, some people are not okay with anal play, but there's the intersection between which we call as the perineum. There's a great intersection happening there. You could
Mhm.
touch it. You don't have to go inside if you do not feel
Yeah.
comfortable. And I think these conversations need to happen much more casually, without a frown on our faces.
Yeah.
And I think that helps a lot, because we know that this is a script that, like I said, this shame, guilt, and boredom was, when I speak of people with penises, this is like a common theme which I see, is that they are restricting the entire pleasure practice
Mhm.
to their penis and ejaculation, and it's done
Right.
within 2 minutes. Within,
Performance. Yeah. Just the
exactly,
performance. Yeah. Mhm.
exactly. And so that is something that I think particularly happens in people with penises. When it comes to people with vulvas, oh, where do I begin? We know how we actually know it's the patriarchy. We um we have also in a way sort of um we also in a sort of way have feed into people's egos, that or into our partner's egos, when we fake orgasms, when we say that this was pleasurable, or
Mm.
us not voicing out what we actually want, or if we want it in the first place or not.
Mm.
I think that is something very negative that we have done, which in turn causes us more guilt and dissatisfaction with how we experience pleasure. And I think that in itself needs to change, because for us, for bodies with vulvas, we need to spend some more time in front of the mirror, and we
Mhm.
need to see our vulvas more often. We need to see our bodies more often, because there's just so much insecurity there. There's just so much shaming hidden in every single part of the body, be it looking at our breasts, be it looking at our necks, be it looking at our navel, thighs, hips, every single part that we know that is like a pleasure spot for us, or could be the pleasure spot for all of us, is somewhat hidden in shame, that I do not like this is a body part I absolutely do not like. This is a body part that I would like to change. While there's nothing wrong with it, but there's also a primary dissatisfaction, especially for cisgender people who just trying to fit into the molds of this is how we need to be worthy of experiencing pleasure. It's the constant idea that we have to be worthy of experiencing this in some way. We have to do this to value our pleasure. If we do this, that is how we experience pleasure. Instead of just exploring it for ourselves, we'll be like, it's there, it's everywhere. It's right from head to toe, it's everywhere. Even if we change ourselves, even if we do not change ourselves, it's gonna be the same. It's still gonna feel the same.
And it's always there and accessible. It's a matter of, are we taking the time to pay attention in a compassionate, gentle way with ourselves, rather than what you're saying, Dr. T, all this negativity for our parts, that I don't like this, I don't like that, I'm not enough, um, and where's this metric coming from? Like, what are we measuring ourselves up to? And where did that come from? Who planted those
It goes
seeds?
back,
Who planted those
goes back
weeds? Maybe I
to
should say weeds and not seeds.
like I said, it goes back to those people policing the culture, saying that, oh, your culture teaches us this way. I don't think our culture just said, you know what, be happy, don't do bad. That's it.
Yeah,
That's all our culture wanted us to do.
right.
The whole cultural policing just makes it worse. And it's through the generations, I think, to unlearn all of that again, we all want to be ideal kids. Either we want to be ideal or we want to like be rebellious.
Yeah.
There's no midway, right? There's no midway. When I think even now that I have these conversations, I could not have imagined having a conversation with my mom 4 years back or 3 years back, saying that, you know what, I masturbate.
Mhm.
But saying that today, having a sex toy next to my bedside, or having a bottle of lubricant next to the bedside, joking about the condoms and whatnot, it just could not have happened. But there have been continuous conversations, conversations where I do not frown, conversations where I do not get angry, or you know what, you don't know this, you should just shut up. It's okay if she does not know. I'm going to give her her space of grace. I'm going to keep myself, I'm going to keep a space for myself to understand that, you know what, it's okay. Understand. They may not be right, but that does not necessarily mean I want to make sure and assert that rightness onto them. So I think that space of grace, even for clients and patients, just helps. Some of them just say that, you know what, we do not want to talk about it. And I'm like, sure, fine, I'll back off. This was
Mhm.
not to insult you in any way. This was not to, this was not an assumption. I think these are just a standard set of questions. I think, I'm not sure if you've encountered such a situation before, but oh my God, I've had it once or twice, and I'm like, I'm sorry. I'm just doing my job.
Yeah, yeah, and that I think is just, meeting people where they're at. We're planting seeds. We're providing permission for folks to talk and to us and open up to us about their. We all, here's the thing: we all are curious beings. We all have questions of, am I normal? Is what I'm thinking about normal? Is this okay? What are other people going to think? Like, we're constantly in that, especially around our sexuality. I feel like we've all have curiosities, sexual curiosities, that we're wondering, oh, I wonder if anybody else thinks that way or finds this feel really good or pleasurable or likes this or that, right? And what you're saying is, we're just not having these conversations to validate, to affirm, to reassure, to normalize, right? The fluidity of our sexuality, and to embrace the diversity in all of that, right? Um, and yeah, I mean, some folks are just, and that's okay too. Again, we're not here to say, hey, you have to be right. You have to be open to talk about this and etc. No, I mean, everyone has their own starting point. I certainly didn't start comfortable and talking about sex and saying, yes, I'm going to have a podcast called In Your Pants, and we're going to we're going to talk about all things going on in your pants, or that I'm going to be a sexual counselor, educator. I never would have thought, 20 years ago, that I would be doing this work, right? But it's through doing my own work, and that this has opened up my sexual freedom, my sexual voice, liberation in a way, right? Just liberating myself. And it's not an end destination, folks. Like, right, Dr. T, this isn't like all right, I'm going to do the work and then it's going to be over. Then I'm done forever, right, Dr. T?
I'm just shaking my head like, no. And this is something that I also spoke about was, it's an assumption again that people think that, oh, my friends and I usually have these conversations. They're like, oh, you talk about sex and everything else. Your sex life must be great. You must not experience any problems navigating everything. And I just give them a dumb look because, hello, hello. I I just said I can treat or I can cure, I can help, I can prevent. Who made me God of these things? Nobody. I'm still human. I'm still
Right.
gonna make mistakes. I speak of words of affirmation here. I speak of love languages here. But then there is gonna be a point in time where I'm gonna be like, what's this? I don't like it. Just
Mhm.
move away.
Yeah,
I'm gonna be one of those people. And that's okay. That's completely fine. We are still human. We are still human.
that's right. And we all have our struggles and fears and anxieties over things, and we navigate them very differently. There's not just one way to do that. There are many, many paths. There's many, many different ways to explore and to go through your own journey, right? And yeah, this is not about right or wrong or yeah, none of that, right? It doesn't have to be one single way or have to look that way. So glad that you brought that up.
Mm, none. And like to be very honest, I would say this. I keep saying this, but I'm gonna say it again over here because I know awesome people are gonna hear this and I just hope they remember this. When we speak of normal in medical language, we basically are not saying that you're abnormal, or we are not saying that this is how you're supposed to be to act normal. When we speak of normal, it's because we have seen a population over a period of time, researched about it, and we are saying that this is common or this is healthy. This is not something to be pathological, right? That is what we mean by normal. And
Mhm.
so don't try to fit into that mold because we do not know what normal is either.
Right.
Until unless it's not about harming yourself, harming others, we are not going to talk about normals. And so I've officially taken that word, thrown it out of my dictionary,
Woohoo!
making sure my clients throw it out of their dictionaries as well, and they just be their weird own selves, own it, embrace it, and yeah, just do that. Who wants to be normal anyway?
That's right. Right. I mean, like you embrace your uniqueness. And I thank you, Dr. T again, wisdom bomb. Um, for dropping that because that is so important again for folks to hear. You're right. What is normal, right? Where are we comparing? No, we're all there is none. Let's get rid of it. Done. Trash. Got it. Cool. Well, speaking of, I know we were talking off the air about chatting about a few cases from the OT perspective, and I'm so excited to talk about butt plugs.
Yes.
We're gonna talk about a butt plug case. Let's do it, Dr.
Yes.
T.
Yes. Okay. So this was the reason that I chose to share this case because this was the most interesting one because butt play is not something that is still legal. At least penetrative anal play is not something that's legal in India yet. Okay. So when we speak of anal play and people who want to consensually explore these things, so we sort of met one of my clients. They identify as male, cisgender male, and they were suffering from erectile dysfunction. And we again were starting to look for pelvic therapy and everything else. And they actually met me. I was like, you know what? Do you want to? I have a physiotherapist who works great with pelvic floor, and I absolutely do not think that you need me for a very long run. There are some things that I can help you with, and then possibly you can continue with the physiotherapist for pelvic floor strengthening. They sounded good. And I was like, you know what? This is what we can do. In the first session, this was all about patient education and everything else. This was all happening in the first session. And my very, very, I was very happy that one of my colleagues, my physiotherapist, she agreed. And she was like, you know what? Yeah, sure, let's do it. I'm like, do you mind? Because ideally in India, your rehabilitation sessions are not covered by physiotherapy or occupational therapy, or insurance does not cover these sessions. Okay,
Mm.
until and unless you have suffered an injury or you have like a prominent illness or a disability where you need to go to a physical therapist. That is how the insurance covers it. And obviously, ED did not classify like a very important dysfunction for them.
Right.
So yeah, even though the person had so many mental health concerns because of that, had problems focusing in their own occupation, it's still, yeah, insurance companies.
Right.
They suck. Yeah, they suck. So when it was very important that the patient agreed, and when they did, it was so nice because I and the PT got along together for the first session. We were like, you know what, we have 45 minutes. Let's use it in the best way possible. This is how we're going to separate our time. And while she worked on pelvic floor exercises, I started talking about, things that how can you control the sphincter movement? How are you going to relax it? This is a lubricant you can keep at hand. This is going to be good for your anal pH. This is going to be fantastic. You don't have to worry about it. And then we, in the meantime, we were like, you know what? Would you like to try? If the sphincter is not giving you a very good feedback, like
Right.
controlling and releasing it if it's not giving you good feedback,
Mm-hmm.
there's something we could try. Would you like to look at butt plugs or any of the sex toys that you would like to buy? They're like, isn't that for gay people?
Ah. Uh-huh.
I was like, whoever told you that needs to, again, my hand, your cheek.
Metaphorically. Yes. Yes.
I was like,
Oh,
oh
another
no.
stereotype.
I'm like, no. And like I said, it's bullshit. It's bullshit.
Yeah.
Whoever's telling you that is just, they just want you to suffer, and they do not want you to experience the maximum way in which you can experience pleasure. And
Mm-hmm.
then that's when we had this great conversations about, this is how the same we have the same erectile tissue. This is how it goes for females or bodies with vulva, and this is how it goes for bodies with penises. And then you have this amazing prostate, which has so much power and has
Yep.
shown such great results for people with erectile dysfunction. And they were like, you know what, sure, we'll give it a try, but if I do not feel comfortable, and if I just do not use it, um, is that okay? I'm like, absolutely. Nobody's going to force you. If you want to, you can not go to this step or, this stage. We can still discard this. You can try it with your fingers.
Mm-hmm.
But they seem to be quite adventurous, agreed to go on an adventure together.
Yay!
The already awesome adventure of a PT and OT coming together, and then again some video, and then with butt play, it was such an adventurous session. And I think after 4 weeks, I followed up. I think once they continued with 3 sessions with the physiotherapist for pelvic floor strengthening
Mm-hmm.
and sphincter control. I saw them once a week, and after like about 4 or 6 weeks, they were so happy to even um, experience orgasming without erection.
Amazing.
And this is something that I don't think a lot of people with penises acknowledge,
Mm-hmm.
that they can still experience orgasm without an erection being there.
You sure can.
And that, oh my God, the smile, the relief, and it just makes you. I think everybody wants that validation that oh, I'm not broken,
Right.
or oh, I can experience this. Is my body really doing this? And for them to have that revelation that, I'm sorry, for them to have that revelation that my body did this, that was huge. And to be very honest, they saved so much time. They saved money because they did not have to come to me all the time. I was there to reflect on how the occupation is being done, if I'm going to need another session or not. And we could have split the session in such a good way that I know that if you know what, my physiotherapist therapist knows kinesiology and pelvic strengthening, and they can do that much better. They know how to conduct these exercises. That's right up their alley. Let them do it. And then I can come there, help them how to modify this occupation when they're actually masturbating. And that's such a fun collab
So
because
fun. Powerful. I love it. PT, OT, unite. That's great. Great. And it was for the sake, again, for the sake of the person that was seeking help and had the courage to seek help for their erectile difficulties. Right? I mean, just think about it, folks. Like for someone to even just call you, right? Or call a health provider or to disclose like, "Hey, this is really bothering me. Like, is this something you can help me with?" That takes so much bravery to do for anyone.
and exactly, and after having especially when you go to Google and you
Yeah.
search about erectile dysfunction, or you talk about premature ejaculation, there is so much written about physiotherapy. There is a lot more written about surgeries and medications,
Yeah.
and um, and like there is a lot more that you need to do in order to feel better. And in this entire time, and the reason I think an occupational therapist and a physiotherapist helps is because in this entire time we are still forgetting that it's also their mental health that gets impacted so much severely. Their confidence, their self-esteem, the way that they engage socially.
Mm-hmm.
Forget let you I'm a single person. I feel attracted to somebody if I know that I cannot experience this or this, or certain things are not uh, sexually are not in place for me. That impacts the way I'm gonna even date or find a partner for myself.
Right.
And there's just so many layers to it. And I think that is exactly why I think having rehab professionals when it comes to uh, anything sexuality, we need to be there. We need to dominate the
100%.
space.
100%. 100%. If we can deal with toileting and talking about peeing and pooping and accessibility to go to the toilet,
That's the most intimate thing, and we are there.
we
That's
are
the most.
there. We are there and so open to talk about modifications and assists and caregiver training. And that includes also sex, folks. Our sexual parts, our pleasure, our sexuality, all of it. Speaking of, I wanted to talk about another case with you, if you have any kind of in your wheelhouse about for those that identify with a disability. I mean, I know that could be a very broad range. Um, what cases, as far as adaptations, modifications that were integrated into sexy time or pleasure exploration, right? Because sometimes, I'm thinking about like aids or assistive devices that seem very, they're stigmatized to be very medical, right? And we're taking a spin on those and saying like, let's make it sexy. Let's add that to our pleasure exploration. Could you share with us like a case or it could be anything that you have on your mind around that topic?
Oh my God, this is so nice. Oh, okay, so I'm gonna give you fun ones though. Okay, so I
They're all
had
fun. They're all fun.
they are great. So I had a cisgender female married who had undergone a total hip replacement and was still using a walker for just home mobility. And just one day when we was again like having these conversations, I
Mhm.
make sure I always ask about sex, always tell about contraindications, indications. This is the position that you can go with. How much do you want to hold off? How does the pain medication going to affect the way that you experience things?
Yeah.
Lubricant recommendations always on the side. This is in the entire process. I do not want them to feel overwhelmed at any point that, oh my God, just because this happened, my genitals stopped working. My body does not understand sex anymore.
Mhm.
So so that's my jam. And then I was like, they were like, I don't want this. This walking aid just ruins everything for me. I'd always loved that standing position I used to do, and you know what? This just ruins it for me. I do not like that. That's the ultimate way for me to experience it. I was like, you know what? Just hold off a week. In the meantime, you can try this alternate position, and after a week, let me know how your pain is. Let me know how you are feeling, and possibly we can find something out together. Just in the whole anticipation of knowing that, you know what, I need to get better. I need to know what can be done, what can be done. I think that anticipation was so great that she was like, you know, I want to know it. What is it? What are we going to do? The pain has reduced. The ranges have improved. And just tell me, what can I do? And I'm like, you know what? You were cursing that mobility aid so much. Now that there's time to ditch it, before that, why not use it to your own rescue, right?
Ah,
So we took a stool, just like a normal stool, which is like on a very less height, something that adjusts the pelvic range in which she can stand using the walker.
mm-hmm.
And voila, they can have standing sex again.
Oh,
It's
yes.
not something, I mean, they hated it already, right? They already
Yeah,
hate the aid. They wanted to do it in a standing position. Now they love it. They know that the balance is going to be great. They're not going
yeah,
to have a fall.
right,
And it's just like, it's a very small modification, very small. Something that does not make you feel that, oh no, I cannot experience this while I
right.
still have this pain or I have this limitation.
Mm-hmm.
I think even um, a similar case goes for a client, an adult I had, actually not even an adult, it was just like in the early 20s with spastic CP. And they were like, you know what, my with hand deformity, and saying that, you know what, I cannot ask my caregiver to um, say that, give me a hand job. This is not something that my caregiver has signed up for. Not even a conversation I think most parents here or households have here for disability kids. So I was like, you know what, let's have a conversation with your parents about how can we navigate these things together.
Mm-hmm.
And while they still had an equipment like a universal cuff just to fit in things, right?
Mm-hmm.
We were like, you know what? Let's try a vibrator, even if it's just a bullet vibrator. You know what? We can still find an attachment for it. So eventually, I had to make sure that they get a different universal cuff so that they can at least have two different sizes of vibrators inserted in there, even though they were still bullet vibrators, so that they can insert of different lengths, different intensities, and that not only helps in that vibration, not only helped in relaxing the spasticity of the hand. And then again, it's so tricky that we had to sit down for the first two sessions just to understand how it feels on different parts of the hand,
Right.
say probably neck, like places that they find at least in acceptable areas in a setting. How can they find it pleasurable? What should the intensity be so that the spasticity does not increase? Something that's relaxing creates a good mobility for the next, say, 10 minutes or 5 minutes. Record the time and let them practice that when they go back home. How is that going to be helpful for them? Who can help them navigate, even having these conversations when we're talking about disability and adaptations.
Mm-hmm.
uh, which person can be around, how much is the caregiver actually ready to support the patient
Right.
through this. And I think navigating, even though it's so much fun, sometimes it can also become very embarrassing in situations like these. So having accessibility to porn or say erotic media, what are they going to choose, what's acceptable to them, what do they want, right? So that even though they are exploring themselves in despite their disabilities, it should not be shameful. They already have so much more going on with them. So I think, yeah, this is again something so beautiful, again so tricky, but to navigate that in a setting like this, it's fun.
Absolutely. And a trailblazer you are, and the people that you're working with, how amazing it is to have each other. Having each other to work with, right? Like, I just feel like even as a clinician, there's so much that I learn from folks too, with their willingness to explore such intimate topics and conversation, and what a privilege it is. And so I say with each other, because it's a power with, I'm always a power with person instead of a power over. And it's just a beautiful collaboration when you're in that when you're navigating that therapeutic space, that therapeutic alliance. So
Absolutely. Um, I'll tell you what my client taught me, and I think this stayed with me, and I think somebody can try it out there as well. So they have rheumatoid arthritis,
mhm.
and they had been diagnosed for about 2, 3 years, and they loved how BDSM felt, and they wanted to explore new things. And they were like, you know what, I started using this whip, but that just caused me an ulnar deviation, so basically a wrist deformity. And I was like, okay, so, to even go ahead and find out that these are the variations of whips, this is a range of motion that they can try with whip, which does not cause an ulnar deviation. Other ways that they can hold it, the ways that they can use their shoulders and elbows to make those ranges. That was like a way of strengthening it all together. And it was like, wow, I never thought about it that way, right? Eventually, it's still a sexual activity.
Yes.
But if it was just me, I think I wouldn't have gone back to think, oh, we can use a whip and we can, shop for a whip like this. This
Uh-huh.
is like a more lightweight one. This is going to be more heavyweight one. This is how it can impact a person with RA, or rheumatoid arthritis, or somebody who has any wrist deformities. Uh, and so that just helps you with analyzing. And I think that was one of the times that my client really facilitated that, what, this is what you can do. Even though we are trying to incorporate something in the practice for them, this is still a valid occupation that they want to engage in. And they're just saying that, what, don't just have it play. I cannot say that. I cannot say that. Until unless I know that it's absolutely harmful, I cannot say that.
Right.
Because it's a pleasure source for them. It's something that empowers them. And just to figure that out, I think, yeah, that was one of the another case examples that just,
Love it.
blew my mind. I was like, yes, they make me learn so much.
Oh, I love it. I love it. Oh my gosh, there's so yes, such a team. I love it. So, Dr. T, where can our listeners connect with you, reach out to you? I know you have Instagram and a new podcast, so share all the goodies with us.
So you can always find me on Instagram. Everybody can find me on Instagram. I always have free resources there. I love to connect with people there. And the ID is Sex, Love, and OT. The website goes with the same name, sexloveandot.com. You can drop me a mail at sex.love.and.ot@gmail.com. And I'm just everywhere. Just Google, just put it there. Just put sex, love, and OT, and there will be a beautiful face that pop ups. That's mine, and you can reach out to me. You can my DMs are always open for people, unless it's perverts. Then again, it's the hand and the cheek.
That's right. That's right. We will not tolerate that inappropriate behavior.
Absolutely not. And I
No.
think, yeah, there's just a bunch of things. People can find everything on the website. They can find everything on Instagram as well. I am not a monster. I'm mostly very friendly. So
You're a wonderful
yeah,
human being and are doing such wonderful, amazing work. And we need more folks like you all
we
over the
need more
world. We
healthcare
really
professionals.
do.
We need more healthcare professionals like us
Mhm.
who can do these things, who can come together, who can help expand each other's brains.
Yeah.
Just hype and be like, yes. I think that hyping and the pom pom, because
Yeah, that's a good pom
we
poms. I forgot.
yeah, because I think in the entire journey, even though we are here to serve and care for people, there is still a population of people and healthcare workers like us who are still not validated as humans. And
Hmm.
I think this experience of, having this community, having to come together, share these experiences, and know that, we're here for each other, we're cheering you. and we're going to continue doing what we do, and it just it just makes it, everything is worth it because somebody actually feels better.
That's
So
right. That's right. Someone's world just
let
changes
me
and improves, and yeah, and that's just a beautiful thing. We're here for each other, right? And to cherish other people and not bash them or judge them or criticize them, because we're all in the same boat, folks. So what a beautiful message, Dr. T. Thank you so much again for being on the show, for all the work that you're doing for everyone. I have learned so much today from you. Thank you so much, dearly. And to all of our listeners and viewers, thank you so much for being here with us. And until next time, my friends, in loving wellness for your pelvis, this is Dr. Susie. Bye.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.